Welcome to the webinar entitled From Chairside to Lifelong Health and Your Role in Systemic Wellness. I am absolutely thrilled to be able to spend the time with all of you over the next hour. We have had an amazing, overwhelming response, which makes me realize that we are all very, very interested, deeply interested in how oral health is connected to systemic health. But in the reality of practice, how do we take this information? We know it's all connected, but how do we connect this in a meaningful and an understandable way to transform a routine recare visit into an investment in lifelong wellness? So I am looking very forward to exploring this option with you over the next hour. Let me just advance my slide here. A very, very quick disclosure and responsibility statement. I have been a dental hygienist, or I am a dental hygienist registered for now over 4 decades. I have presented over 1,000 presentations worldwide. I have been a Dentistry Today CE leader for 14 years and confirmed actually for next year. Published. You can see my professional relationships there. I do not have a financial interest or an investment in the sponsoring company, which is Philips Oral Healthcare. However, I do receive a speaker fee. And having said that, I would like to give a sincere thank you to Philips. I'm always amazed at the opportunity to be able to develop programming of my own making, of my own creation, supported obviously by strong science, but not to be presenting a product-based presentation. And that commitment that Philips has made to our professional community is exemplary and very different from several other industry leaders. Viva Learning as well, I would like to give a big thank you. Viva Learning has provided us as a professional community with so many wonderful opportunities to elevate our educational level within our chosen profession. What are we going to learn in the webinar? Upon completion, I would like you to be able to understand the biological pathways of oral inflammation and the impact on systemic health. But more so than that, recognize your critical role, the role of the entire dental team in promoting overall wellness. And also looking at solving some of those self-care challenges with really innovative, science-based product recommendations. So what is out there? What works? And yes, I will talk about a variety of different topics, because I feel it's important for you to emerge after investing your time with us in an opportunity to be able to have solutions to bring back to practice. Knowledge translation. This is my signature. I have provided a handout and also a resource which will be made available to you, or has been made available to you. That is always, again, another important part, to be able to take that information back to practice. But I also do want to bring attention to the fact that I am chronologically enriched. I prefer to say that instead of saying I am aged or older. I have learned something in my over 4 decades in this wonderful profession. I've consciously allocated my time to research only those areas that are going to directly impact your clinical experience and the patients you serve. I want this to be valuable to you and meaningful. The objective is to translate this knowledge directly into clinical practice to ensure optimal treatment outcomes, mitigate risk for disease advancement, both orally and systemically. So that's really my job and my objective with spending this time with you. I want you to know you're not out there alone. I know these are concerns that we all have, whether we are a dental hygienist, whether we are a dentist, whether we are a dental assistant, whether we are a member of the business team. Many, many times I know this comment would come up in my own mind. I don't have time for this. Patients not interested at all. They're saying to me things like, I only want what my insurance covers. I want my cleaning done in one appointment. All these pressures that if we take these upon ourselves, can really mount up to a very, very stressful day. And then the last part is, how do I even explain this? I've only got so much time. And how do I even begin to explain this oral systemic link in the already crowded appointment that I have? So we're here to help. There are two main resources in our hour together that I do want to bring to your attention. The first is the Path to Health. This is a new initiative by Philips Oral Healthcare. It's an in-depth guide to oral care. And it has a section, as you can see on the tabs on the right-hand side, in preventive care, patient conditions. So it talks about inflammatory conditions, periodontal disease, caries, also pathology. And what about in-office care, different treatments that we provide, all covered in this guide. And it also has at-home care. So there's a lot of great information. This is also a guide that has been put together by industry experts that enables you to be able to extract any portion of it and be able to put it on your website, to put it on your socials, to be able to bring more enhancement to your practice and that you are truly committed to prevention and optimal care. The second resource, I'll go over this with you and give you some tangible examples in the form of case scenarios. This is a medical history update, and this is something that I developed a number of years ago in practice when I was doing practice management consulting with Advanced Dental Education Institute. And it was an opportunity to really make a connection with a patient. And I want to go over that in quite a bit of detail as to how we do that in today's world. So, the first educational objective or learning outcome is to understand those biological pathways of oral inflammation. How does something that's happening in the gingival sulcus actually impact entire systemic health? And why, with one patient compared to another patient, do we see such an exacerbated condition, whereas another patient can have perhaps more debridement required, but not having the same kind of destructive nature of periodontal disease. It's been a mystery. And when I look back, 4 decades ago at the way we practiced many, many years ago, our historical beliefs were so different than the knowledge we have today. It was much more of a cookie cutter approach to our therapeutic outline for patient care. So the first one here I want to talk about is cardiovascular disease. And you'll see a little asterisk up in the corner. And the reason that asterisk is there is that this is a need to know for the post-CE test. So I want you to make sure you understand this and listen up to this because there are a few points here that will be part of the post-test. So first of all, when we look at bacterial lipopolysaccharides on the outer cell wall membrane of gram-negative, not gram-positive, but gram-negative pathogenic, periodontal pathogenic bacteria, we have lipopolysaccharides that initiate, and this is important for you to know, the cytokine storm. So what is that cytokine storm? That cytokine storm is made up of interleukin 6, which actually was the very, very tiny little protein that was one of the markers, one of the biomarkers that actually was isolated early on in the stages of COVID as being that biomarker that was closely associated and connected with the need for a ventilator. So it's a very, very critical component of that cytokine storm. The next one I want you to look at is cytokines plus MMPs, matrix metalloproteinase. This is really important because the one we're going to look at specifically is MMP8, which is collagenase. One job to do, break down collagen. So we're looking at cardiovascular disease, but I could look at many, many other examples of systemic disease and how MMPs have played havoc with destructive aspects in different areas of the body. So all of this enters in through that body's highway into every organ. Let's look at what it does with the liver. The first thing it does is that it enters the liver is the liver senses, okay, we have an elevated level of pro-inflammatory mediators here and inflammatory mediators that has started a systemic infection. So at this point in time, that barometer that tells you the level of inflammation in your body is CRP or C-reactive protein. It combines with cholesterol and unfortunately not the high density lipoprotein, but the low density lipoprotein. I always refer to HDL as happy, LDL is lousy. And unfortunately, we get this complex of LDL plus CRP into this fatty, what is referred to as a foam cell. This enters into the arterial system, and all of a sudden, we have an atheromatous plaque. The only thing that is preventing a rupture, like a myocardial infarction, a transient, a TIA, ischemic attack, a stroke, is the rich collagen cap. But as you can see, that cytokine storm generates a lot of MMPs, that's collagenase, with one job to do, and that is to break down collagen. So as this circulates through the entire body's highway, it is breaking down collagen, and this places our patient at critical risk for cardiovascular disease. Now, Alzheimer's disease, this is a really interesting one. And again, this is a need to know. P. gingivalis, one of our keystone pathogens, enters the bloodstream from the gingival sulcus. What it releases is something called a gingipane. Remember that word, gingipane. It's the chief virulence factor of P. gingivalis. It's classified, get this, as a collagenase. What does collagenase do? It breaks down, it destroys, it degenerates. Gingipanes influence further expression and activation of the host MMPs. So we not only have gingipanes that are happening at that cellular level, it also is impacting the entire host to release more MMPs. So gingipanes literally disrupt and manipulate the inflammatory process. So when they look at research, it's really unveiled that the pathogenesis of Alzheimer's disease is directly related to the secretion and load of gingipanes. And this is being found out through investigation of cerebrospinal fluid with patients that have dementia related to Alzheimer's and also with autopsies. So how do we explain all that? That's a big mouthful, everything that I've just gone over. Your mind could be possibly spinning at this point. This is where the Phillips Guide comes in and is such a wonderful help to you, where it outlines in more simplistic visual terms exactly what's happening. So you don't have to go through everything I've just told you. That would be far, far too advanced for your patients. But you can narrow it down to be able to talk about diabetes, dementia, cardiovascular disease, and pregnancy complications. Here's another easy way of looking at it. And I would suggest that, in your handout, there also is a slide here that replicates this. This is a great one to put on your visuals, on your socials, or also just to have laminated and have available in your treatment room. So we have on the top level, healthy inflammation. And there is such a thing as healthy inflammation. There might be a virus, there could be an acute type of bacterial infection, but nothing that's chronic. Your body has a wonderful opportunity to call in the reserves. You have that cytokine storm that starts up, but it also has an endpoint. The clinical outcome with the balance of tissue repair is healed tissue. Now, as we go down to that lower level of your screen, we have an entirely different picture. And I love this. I think this is so wonderful to be able to easily explain the difference between healthy inflammation and chronic and prolonged inflammation. And this was actually courtesy of Oral Science that put this together. So if we look at this particular situation, this is not an acute, short-lived inflammatory reaction. This isn't something that, is related to an insect bite or whatever. This is chronic inflammation. And we know that the most common chronic inflammatory disease known to mankind, write this down, is periodontal disease. So when you're showing your patients this chart, make sure they understand that the most common chronic inflammatory disease is periodontal disease. So what's our clinical outcome? This is host response now. So this isn't at that local level. This is now involved the entire host. So we have destruction of tissues, we have loss of bone, we have bone density, we have amplified local and systemic inflammation, which is dictated by that CRP level. And we have a new inflammatory disease possibly starting up in another area. So again, this is a need to know. They are all chronic inflammatory diseases, whether we're talking about rheumatoid arthritis, cardiovascular disease, diabetes, lupus, the list goes on and on and on. Periodontal disease, they are a consequence of unchecked or undiagnosed ongoing inflammation. All chronic diseases have excessive inflammatory responses. The primary difference is anatomical location. Again, another great statement for your website, newsletter, your socials. Get this information out there. And please know you have my 100% permission to use anything that I have spoken about in this webinar. Not territorial. It's too late in my life to want to keep everything to myself. We need to get this message out. It's so, so important. So, what is our role? If we start to look at the critical role that the dental professional plays in promoting overall wellness, we start to see that our role is an area where we can truly make a difference. I think we would all agree if we look at today's healthcare focus, it's more reactive versus proactive. How often do we go on a preventive basis when it comes to our medical health? Most often we go because of a reactive nature. Now, we might go routinely to have a mammogram or a prostate exam or whatever that may be. That's great. But a lot of times we are going when we actually have an issue at hand. If we look back at how we have evolved over the years. Yes, this is a picture of me years and years and years ago, actually at the clinic at the University of Toronto in the dental clinic. I know it is appalling, and probably those of you that are young in the profession, you're probably gasping at this moment, seeing me without a mask, without gloves, without glasses, and the patient not protected either, and that contra angle, that handpiece, my goodness, it's amazing that I can still actually use my wrists. Fortunately, I discovered technology and ultrasonics and, ergonomically speaking, loops and some other critical components. But what I wanted to demonstrate here is that we had a different kind of communication years ago. When you look at this picture that was taken about a year ago, I was doing some filming for our national association. We can see that there are a number of barriers. We see my colleague here who is in a mobile centered dental hygiene practice. There are a lot of barriers to our communication now. Gowns, masks, glasses, visors, shields, all of these different things that sometimes make it a bit more challenging to make a connection with the person seated in our chair. And that is so important. I always remember hearing this years ago, and I didn't really fully understand how it applied to our profession. People do not care how much you know until they know how much you care. I know all of you have probably heard that expression before, but it is so very meaningful. Until we make that connection and the patient really feels cared for, they are going to tune us out in many, many cases. If we look at the knowledge that we have, if we only have the knowledge and we don't have the heart, it will not pursue, it will not evolve, I should say, into action on the patient's part. But once we add that heart and the patient knows that we truly care about them, It's almost like a light bulb goes off and the patient moves into action because they can see that you are trying to help them. And they're starting to understand that maybe there is a problem that they need to address and they need to be educated about. Until they actually perceive that problem, they are never, ever, ever going to buy into the solution. So if you haven't connected with your patient, if you haven't found that internal motivator, they're not going to perceive the problem. And they're definitely not going to buy into the solution that you are presenting. First of all, one of the things I want to ask you, do you feel that you're uncovering the information in your standard medical history update, such as their familial history, maybe unknown risk factors that are inadvertently placing them at risk? And what about subjective symptoms? Subjective symptoms as well. And I'm going to go through a couple of case scenarios with you, as I mentioned, so you can see how this actually works. So we know that chronic inflammation connects systemic disease. So a condition in one anatomical location has an effect that reaches far and wide. But does your patient understand the connection? Does your patient understand that what is going on in their mouth could actually be setting them up at risk for autoimmune disease in the future? I bet if we polled or surveyed our patient base, they wouldn't understand that concept. And what a great idea to be able to survey our patients, maybe a few simple questions. Great way to interact with them in the reception area. Something that comes up on the monitor with messaging, a quick survey, asking them that question. Do you understand the treatment fully? Do you also understand what will happen if you choose not to accept the treatment? May I answer any questions for you before we schedule your treatment? So the next step is patient engagement, having ownership of the problem. And how do we do that? Well, I always say WIIFM. What's in it for me? Write it down, WIIFM. And make sure in your dialogue with your patient tomorrow morning that you're answering that question. They're not going to ask you that question, but they're sure thinking about that as you're sharing all this voluminous knowledge that you have. What's actually in it for me? Why should I be listening to this? Or what does it really matter? You know, my gums only bleed when you jab me with that pokey thing, right? I know you're silently chuckling out there because a lot of our patients think that. My gums don't bleed at home. Well, their gums don't bleed at home because they aren't thoroughly cleaning their mouth. They aren't cleaning interproximally. They aren't using any type of um, interdental cleaner or anything at all to be able to access an area where there is actually pathology. And it's painless. Until periodontal disease is in a later stage, it is painless. And it's not really a concern to the patient. So I want to now bring in that second resource. So the first was the guide by Philips Oral Healthcare, The Path to Health. The second one is a medical history update. It's pictured on your slide, and I have provided this to you in a Word format. The reason I put it in a Word format is you might want to change it up. You may look at it and say, I like this, but she hasn't included a question about this. Or we now understand about prophylactic antibiotics. So we're going to take that question out. Or we want to go a little bit further with one of these other questions. So please feel free to do with it whatever you would like to. You can put your practice logo on it. You can change it up. It's a checkbox style. It's meant to be really easy. It starts off with a preliminary introduction. Recent research indicates a strong relationship between the mouth and the body. Since we now know how closely they are related, we are going to be asking you some questions about your family history and your overall health that we may not have asked you about before. So that kind of sets us up when our patient says, well, why is this happening? Why are they doing this now? Why didn't they do this before? Were they not on top of their game before? Is there something, that I should be aware of that they haven't told me? It just takes away all of those questions. This additional information will assist us in providing the best possible care to maintain your oral health and overall wellness. So as you can see, there are a number of questions there. I have watched people do this for the last number of years when I've worked in different practices. It takes them about 3 minutes, so it doesn't take long. Where do they do this? Not in your treatment room. I'm your colleague. The last thing I'm going to do is give you something else to add to your list of things that you already feel stressed out about. This is done in the reception area, or it can be sent to them digitally before they come in, or they can do it on a tablet, whatever way your software or your practice allows you to do. It facilitates the uncovering of information that wouldn't otherwise be communicated. Last but not least, it enables us to make a human connection because somewhere in there, there is going to be an opportunity to connect with that patient and provide meaningful education. I can guarantee you that you are not asking 26 questions at every appointment. We don't have the time. That's a ridiculous thing to even impose upon you. But I can guarantee you also that there's something in here that definitely will apply to your patient that they might not have brought to your attention otherwise. So let's take that thought process and go a little bit further with solving some of the popular and common oral self-care challenges with innovative product recommendations. And the way I'd like to do that is present a couple of scenarios to you. So the first scenario that I'm suggesting here is a diagnosis of being a pre-diabetic. So that question is on, let's go back for a second, is on that form. If you look down to, where is it here? Smoking, blah, blah, blah. It is a little bit further down. Yes, question number 19. Have you ever been diagnosed with diabetes, type 1, type 2, pre-diabetes, diet controlled, medication controlled, under control, yes or no? This is something that the patient probably would opt to not tell you. Some of them may, but many would say, well, I'm not a diabetic. My doctor has said, I need to exercise more. I need to watch my diet, but they are not actually a full-blown diabetic. So they might feel that, well, as many of them say, well, what does that have to do with my teeth? It doesn't have any relationship with my teeth at all. So there's no point in even saying it. So if you didn't ask, you probably wouldn't know. But prediabetes is a precursor for diabetes, as we know, and also a risk for cardiovascular disease. So individuals with prediabetes have that higher CRP level, which is an indicator on elevated inflammation within their body. So again, it has access to the body's highway and is not just impacting the pancreas and the islets of Langerhans. It is impacting all areas of their body. Systemic inflammation may play a role in the early phase deterioration of glucose metabolism. We know the studies that exist that say periodontal therapy has actually improved glucose tolerance and has given a tangible change in the HbA1c. So that measurement of our blood glucose and the need for insulin dependence. The emerging role of inflammation in both type 1 and type 2, and also now they talk about type 3 diabetes in Alzheimer's disease. That pathophysiology and associated metabolic disorders has generated a huge amount of interest in really looking at targeting inflammation to be able to have prevention strategies and more control of this rampant disease. When you look at the numbers, it is staggering. So what is happening on that cellular level? Again, we're going to see some common denominators. If we look at periodontitis, we see that lipopolysaccharides again, gram negative, need to know this, not gram positive. Gram positive, we're looking at our strep mutans, karyogenic bacteria, but our periodontopathic pathogens are more like P. gingivalis, that gram negative anaerobic. So as we start to see that influence, we get the cytokine storm. You can see that IL-6 again, and look at the box to the right, that nasty collagenase that breaks down collagen. All of this enters into the circulatory system and heightens systemic inflammation. Heightened systemic inflammation creates insulin resistance. As we go into insulin resistance, we see advanced glycation end products or AGEs. So we have an enhanced need for more and more and more insulin. So it's not just what the pancreas is suffering with. If you look at all of the areas that are impacted by diabetes, we know we have a huge job to do. Retinopathy, cataracts, glaucoma, periodontal disease, the exacerbation of it, peripheral vascular disease, foot damage, diabetic neuropathy, cardiovascular disease, brain stroke, cerebrovascular disease, all of these areas, there is no end point. When we look at chronic hyperglycemia, it's associated with end organ failure. It's extremely serious if it's not brought under control. So, what are some of the innovative scientific technologies that have come along that serve us better? First of all, we know with the Philips Sonicare, if we look at the power toothbrush itself, we look at the fact that it has 31,000 brush strokes in our 2 minutes of brushing. That 2 minutes of brushing is equal to 1 month of manual toothbrushing. That's a great stat. Write that down to be able to share that with your patients if they are kind of vacillating between thinking that should I get a power toothbrush? Do I need one or do I not need one? So, so important for them to understand the value of that power toothbrush. But this was a great study. This was a new study that was recently released that looked at patients with stage 1 and stage 2 periodontitis. It was the first long-term 6-month clinical study of Philips Sonicare demonstrating the safety and the efficacy in reduction of inflammatory markers. So they looked at a number of inflammatory markers, including bleeding on probing, MPI, the modified plaque index, and the probing pocket depth, so PPD. The objective was to compare the effects of an at-home oral hygiene program with the manual toothbrush versus the Philips Sonicare Diamond Clean Smart. So it was a randomized, parallel, single-blind U.S. clinical trial. So the subjects return to the clinic every 4 weeks, except for, and you can see it goes from 4 to 16 because of COVID and because of isolation and requirement to be at home. They eliminated the 8 and the 12 weeks because of we were right in the thick of COVID. But look at the statistics here. All patients received SRP, so they all had debridement at study start. And then this went on for 6 months, no debridement. 4 weeks, Philips Sonicare reduces pocket depth in patients with periodontitis. 16 weeks, Philips Sonicare reduces pocket depth up to 26 times more than a manual toothbrush on patients with periodontitis. So these were stage 1 and stage 2. At the 4-month mark, up to 15 times more Sonicare patients converted to healthy gingiva status versus manual toothbrush users. 20 weeks reduces gingival bleeding up to 106 times better than manual toothbrushing on patients' periodontitis. And again, at 6 months, up to 90 times more patients had reduced pocket depths. So when we look at the results are stunning. They are not just a mild amount of clinical significance. They are stunning results with having used a power toothbrush. The key conclusion, statistically superior in reducing symptoms of periodontal inflammation, bleeding upon probing. The periodontal inflammation is measured by the probing depths and the clinical attachment loss compared to the manual toothbrush. And again, the modified plaque index compared to the manual toothbrush at all intervals of re-evaluation. So this is a fabulous, fabulous study. I wanted to share these with you. I think these are brilliant. And again, another example of support of our community. The links are in your handout. And this first one on the left-hand side is something that not only helps us, or helps the patient, but also assists us in understanding the different stages of the periodontal assessment. But when the patient hears some of these words, it's frightening to them to not totally understand, well, what does this actually mean? And where am I at? I remember recently going to the chiropractor and finding out I had quite an advanced stage of degenerative disc disease, and to be able to actually look at the stage and see where I was at, look at my x-rays and see where I was at, was very helpful to be able to understand the condition better. Next thing that I want to show you is another brilliant invention. And this is Dr. Kotsaki's, that is at Rutgers School of Dental Medicine. I have been in touch with him. I have no financial interest in this company at all, but I think this is a brilliant, brilliant app development. So this is an app that is available for free download. It's called PerioCalc, and it's a classification calculator. So if you haven't seen this, download it and try it out. It is excellent. So you enter in the parameters of your clinical evaluation, and right away it will spit out to you and tell you what stage and what grade. So it's something that I find is confirmation that we have evaluated correctly, but it's also almost like a third party influence to your patient as well, to help them understand that what you're talking about is truly of a concern to them. I wanted to read this comment to you. This is from the voice of a patient. I often have choking and coughing spells. Sometimes I feel a sense of panic because the food blocks my airway and I struggle to clear it. Can you imagine how that feels? Think of the social isolation for somebody that can't clear their airway because of choking on food. Now, if you're reading this, you might be thinking, okay, well, what is the scenario? It sounds like it could possibly be somebody maybe that has HPV, oropharyngeal cancer, and has a large tumor at the posterior base of the tongue. But no, it's not. Listen to the rest. All of us face a grieving process. Having saliva is one of the things that makes us human. It helps us to function in the world, to be a part of the world. And you're not always aware of that, but you grieve for that loss. Xerostomia is a daily battle, and it leads to a very diminished quality of life. We highly underestimate the debilitation that a loss of saliva can impart. It affects their eating. Maybe they're not sleeping soundly because they have to take sips of water all the time, or they have ice chips beside their bed. When they're drinking this water, then that's causing their bladder to function regularly through the night as well. Malnutrition because they're not eating properly, fatigue because they're not sleeping properly. All of these are exacerbating their health problems. So that choking feeling, that social isolation, but maybe they've tried so many different products over the counter that are water-based, and they have to keep using them and using them and using them to no avail. They're not getting answers. So the patient doesn't bring it up, as they've tried so many things and nothing seems to provide relief. So they don't even mention it. They've given up hope. Are we giving patients the validation? Are we giving them the opportunity that they deserve? Do you inquire about xerostomia in your practice? I must admit that for many, many years, I wouldn't routinely. If I picked up on it, I would, but I wouldn't ask it routinely. So I have added that to my list several years ago. Does your mouth frequently feel dry? Yes or no? If yes, on a scale of 1 to 10, how much does it disrupt your daily activities? And then where can we go from there with recommendations? Well, one thing we can recommend again is the smart technology that is built into a number of the product portfolio with Philips Sonicare. This is actually a pressure sensor. So when the patient in that compromised oral environment, in a very acidic environment, is using too much pressure, which can be damaging, particularly with a manual toothbrush, they have an opportunity to be able to be warned and informed about this with this light up sensation. There are a number of other things that are available too with the Philips Sonicare that will help them understand with real-time feedback how they are actually brushing and making sure that they aren't damaging this compromised environment. So we want to ask that question. You've got xerostomia. How can we help you? First of all, we should be checking their pH. And I wish I had a lot more time with you because I go into how to check that and everything else, but very, very simple and straightforward. This is the product I've used, pH Ion. It's available online. I get it from Walmart, buy it online. Some of the health food stores have it. Amazon used to have it. I don't find it as often now. Basic Bites, another great product, has arginine, which is an amino acid bicarbonate, which has shifts the pH and it buffers and neutralizes that environment. X-Pure Remin toothpaste, another great product, nano hydroxyapatite, which is SLS free, low abrasivity, neutral pH. And those nano hydroxyapatite particles are actually able to block the dental tubules. So it works very, very well on tooth sensitivity and also builds an outer layer that is stronger than a fluoroapatite layer. So it is a very, very effective product. Xylomelts, your xylitol 0.5 in each one of the little tablets or the stick-on melts. They're placed opposite on the alveolar ridge above the first molar, second bicuspid, first molar. You place it on, you don't hold it in place, you don't move it around, you just let it stick there. And it dissolves and releases xylitol. Xylitol actually activates a neurological pathway and stimulates saliva. Gel, another fabulous product. Hyaluronic acid sounds counterintuitive, but Gel is produced by the body naturally and is found in a lot of our cosmetic products because it gives more elasticity to the skin. So it is used widely. Unfortunately, during inflammation, it's the opportunity of the body to actually produce it is diminished drastically. So this is hyaluronic acid in a gel that is available in a professional concentration as well as a consumer concentration that can be used after scaling, can be used on oral lesions, aphthous ulcers, any compromised environment, particularly in a dry mouth too, where candidiasis and other opportunistic lesions are going to play havoc with the health of the mouth. The last one, last but not least, is a fabulous product. It is called a Quarrel. And it is a game changer. It has several different aspects to it that actually make it a different product than anything else that is out there. When we look at the other products that are out there, they are all electrolyte or water-based, I should say. This one is lipid-based, so it has an opportunity to actually adhere and form a barrier over the mucosal surface to be able to retain moisture. The other thing that's interesting about it is it has an additive effect. So after you use it for a few days, the mouth actually feels more and more moist, easier than it did with the first application. It is a prescription strength and it is available online. I'm going to give you some more information about it. Little bit of the science behind this one because I'm a science girl and always like to make sure that I've got that confidence to be able to make a recommendation that is backed by science is a Cochrane review that looked at sprays, rinses, gels, all kinds of different products and concluded that OGT, oxidized glycerol technology, or this lipid-laden type of base or this lipid base is much more effective, has a greater level of efficacy than any of the water-based products. So this is a product with a true competitive differentiator. So I have placed a QR code here. It is not in your handout. So I'll give you a moment if you want to take a picture of that. And there are some special incentive programs on at this point in time for the product. But again, a game changer for so many people, particularly those that have really suffered silently and had kind of given up hope. So the website is aquarelspray.com. Okay, let's move on here. Repetition is the key to success in forming a habit. Now, if I didn't have that next part of the statement, probably many of us would say, yeah, that's true. Repetition, if we keep doing things, we've all heard if you do something 30 times, it becomes a habit, whether it's good or bad. Repetition is the key to success in forming a habit. That is a lie. It is simply not true. These are the words of B.J. Fogg, who is the founder director of the Behavioral Design Lab at Stanford University and also the author of Tiny Habits. And I've actually purchased the book. I'm in the midst of reading it. presently because I wanted to learn more and more and more. What really causes a habit to form is the emotions you feel when you do the behavior, like going to the gym. Once you've been successful, you see yourself differently. It changes your identity. You become, I'm the kind of person who takes care of my health. You start to identify with other like-minded people. I'm going to play this video. It is about a 5-minute video. I just would like you to really grasp this concept.
People have heard over and over that repetition is the key to creating habits. And I'm here to say that is not true. That is an old idea. That is not how habits get formed. So many people have tried to change their lives. They've tried to change their habits and they've failed. They are not to blame. It's not a personality problem. It's not that they lack discipline or motivation. They just haven't been given the tools and the guidance and the direction of how to create habits in a way that's easy and impactful. I'm BJ Fogg. I'm a researcher at Stanford University, and I also teach there. While doing my research at Stanford, an important puzzle came together. And that's how human behavior actually works. And I call it the Fogg behavior model. Behavior happens when 3 things come together at the same moment. There's motivation to do that behavior. There's the ability to do the behavior, and there's a prompt. So when you pick a new habit, make sure it's a habit that you want, then you have some motivation to do. But number 2, ability. Make that habit really easy to do. The easier the habit to do, the more reliably you'll do it every day. So you set yourself on a path to succeed because you're not always trying to amp up your motivation. So instead of trying to keep your motivation high, which is very, very hard to do, what you do instead is you make the habit really easy to do. So you don't have to sustain high levels of motivation. You don't have to tap into willpower to do the habit reliably. Change leads to change. Once people change one thing and they feel successful, it opens them up to other types of changes. In this case, creating other types of habits. And that happens for 2 reasons. Number 1, your fear around change diminishes. Number 2, your skill for creating habits goes up. So that combination of the fear diminishing and your skill or your ability going up opens the door to making other changes in your life. What causes a habit to form is the emotion that you feel when you do the behavior. So when you do a behavior and you feel a positive emotion, what that does is it signals your brain through dopamine and it makes that behavior become more automatic. So it's emotions that create habits. One of my favorite habits to recommend to people is to start brushing. To help you make brushing a solid habit in your life, while you're brushing, one thing you can do is think about the benefits that you're bringing to your teeth and your gums and also the rest of your body. So while you're brushing, self-reinforce. Think, good for me. Look what I'm doing to be healthier. You can look in the mirror. Maybe you kind of smile at yourself. So during the brushing experience, you can help yourself feel successful. That will help brushing become a habit. In other words, something you do without even thinking. You just go on autopilot and you don't have to make a decision around it. You just do it naturally. It's part of who you are. So what you do in the tiny habits methods is you set the bar really low. You're making it really easy to succeed every day. And part of what happens when you succeed at that habit, you start thinking of yourself differently. I now see I'm the kind of person who can change. I now see I'm the kind of person who can follow through. I now see I'm the kind of person who can take care of my health and my body. And that's part of what makes tiny habits so powerful. It's really easy to do. You feel successful, and then it changes your identity. And that shift changes a whole bunch of other things in your life. One of the things that we should take very seriously is the feedback from the hygienist or other dental professionals to the patients really matters to the patients. So as they're taking care of their teeth and their gums, they're probably anticipating, when I go in and get my teeth cleaned, I'm going to be praised. And then when they're in the appointment and you praise them and say, good job, keep going, they're going to remember that. And that's going to help them keep going with that habit and also expand to other kinds of habits that will make them happier and healthier. I also think it's a great opportunity during an appointment with a hygienist, for the hygienist to share with the patient, here's how behavior really works. Here's how you can create new habits in your life. So when we help people create habits, however tiny they are, and when they see evidence that they can change, we are giving them hope. It's so great to be able to help people see they can change and give them the confidence and the skills to do exactly that. So many people feel defeated, they feel fear, they feel despair, and for reasons that are really not their fault. And so if we can help people set those negative things aside and open even a glimmer to hope, I think we're doing the most important thing we can do with our time on this planet.
I hope you enjoyed that as much as I did. I love listening to that video. It is so empowering and really makes us feel the ability that we have to be able to motivate people. And ability is a key word for you. Again, a need to know here. So motivation, internally motivating our patients rather than us trying to externally motivate them, but also giving them the tools. That is so, so important. Giving them the ability to be able to be successful. Training is a really challenging method, but if we can facilitate easier behavior change by giving them tools that work, we can help them to implement, as BJ Fogg says, these tiny habits. We also want to focus on simplicity. We want to lower, what that end target is. Tiny Habits reminds me a little bit of Atomic Habits, another favorite book that is really all about making small changes on a day-to-day basis instead of that big overall goal setting. So again, we want to consider our patient values, their preferences, all of those other things, their ease of routine when we make our recommendations. Love this picture because this is basically what I've often heard said, that flossing is one of dentistry's greatest failures. It is such a difficult task to be able to master. This is the Philips Sonicare Power Flosser. If you haven't tried it, I would really suggest as a dental professional that you trial these products so you can speak about them from your own enthusiastic vantage point and help your patients to understand how they work. This has the quad stream technology and pulse wave technology. So basically it is an X where 4 wide streams come out to cover a greater surface area. So you're not just getting that jet propulsion intraproximally, it covers a very, very wide area. I'm a diehard flosser, but the first time I tried it, I put a little bit of Listerine in the reservoir. I couldn't get over the wonderful fresh feeling that I had with it. I felt like I just stood up and walked out of my dental hygienist's chair. So the results of the clinical studies, when we look not anecdotally, but at the science, 180 times more effective than flossing, string floss at improving gingival health and gingival inflammation. 130 times more effective than interdental brushes at improving gingival health. And again, looking at inflammation, much more effective than interdental brushes. So here is your path to health. And you notice that the dental hygienist had the tiny habits, how to form good habits is in there as well. So Philips has taken some of the BJ Fogg philosophy and actually added that, which is great. So your QR code is there for the path to health, and that is in your handout for you. I don't want to omit a couple of other resources for you. This was something that I did with Dr. Pamela Marigliano Muniz on Dentistry IQ that was talking about how to discuss the oral systemic connection with your patients. So that is available for you to watch as well. And Dr. Pam had some great thoughts on this that I thoroughly enjoyed. And then part 2 of what I have done this evening will be released on the impact of systemic medications and dental pharmaceuticals on oral health management. And that will be released by Philips themselves with Dr. Sarah Ballister. Dr. Sarah Ballister she's authentic. She is the real deal, relatable, a very powerful speaker, periodontist, a DSO Leadership Award winner, and is a fabulous resource for you. So again, a big thank you to Philips, and most of all, a huge thank you to you. We want to make it count. We want to make a difference. And above all, we want to make an impact on people's lives. So I see some questions here, and I want to be able to go over these with you. So, first question here, there's a number of them, so I'll try to get through as much as I can, and I want to observe the time frame as well and not keep you too long. Interesting scenario here. Jennifer, my 94-year-old aunt has never seen a dentist or had her teeth cleaned. She has so much calculus in her mouth. She sounds like she is talking with marbles in her mouth. How is she not dead from this? This is host response related. You know, when we look at that whole scenario, think back of those graphics. You can have two different people with completely different situations in their mouth, but reacting totally different, and it's related to host response. It's the same thing when people are much more immune to different disease process, such as even autoimmune disorders. Some people are just much more sensitive with it. Do you mention food-related inflammation like seed oils or other food claims? People spend a lot to avoid those. Might help cell periodontal inflammation management. Likely 10 to 100 times more inflammation. Do you know or mention this? I haven't at this point in time, but I do read about it quite often. So it is something that I talk about as far as nutrition is concerned. How do we obtain the Path to Health Guide? The Path to Health Guide is actually available with that QR code that I provided to you in your handout. So Viva Learning has provided two resources to you, or two downloads. One is your handout, and the second one is the resource. One of the questions is about the recent xylitol study that came up that talked about how xylitol is actually contributory to blood clotting. And for people that are prone to cardiovascular disease and stroke, or have a family history of this, to be very careful. I want to be very, very mindful to make sure that I communicate to you that there's been a lot of dissertation on this. There's been a lot of debate over it. And the fact is that the study that was done, the subjects were given beverages with large amounts of xylitol, like 30 to 40 milligrams of xylitol in it. The study overview by the Cleveland Clinic did say in a further press release, do not throw out your dental products or get rid of your oral health products with xylitol in it, because the therapeutic dose is so much less. Therapeutic dose is about 4 to 7 grams, so much, much less. Pardon me. The type 3 diabetes and its connection with Alzheimer's is its inability to actually be able to process insulin. So again, there is further beta amyloid plaque deposition and further breakdown and degeneration in the brain itself. But they have related this to the blood glucose functionality and not being able to actually metabolize insulin in the brain itself. And insulin is required for normal, healthy functioning. The app is a nice addition. Thank you for sharing. What would checking the pH for the dry mouth patient do? This is critical, because a couple of things that the patient needs to know: that if their pH is in an acidic environment and is low, they are much more prone to a lot of disease processes. For example, caries management. So something like basic bites would be really important. Making sure that they use a really good toothpaste that is going to counteract the breakdown that is happening. Making sure that, again, if they're in an acidic environment, that they're using a power toothbrush, which is going to have a lot less abrasive aspect to it than a manual toothbrush. A manual toothbrush for a heavy brusher can have 400, sometimes 600 grams of pressure. Interesting comment from Tracy. The DDS I work with said that acupuncture works very well for xerostomia. I have heard that before. I haven't talked with anybody or done a lot of research on that, but that's an interesting comment. So thank you for that. And I am going to do some further investigation on that, because that does interest me as well. Listerine is safe to use with the water pick. I can't speak for the water pick, but yes, for the power flosser, the Philips Sonicare, yes, it is. A lot of thank yous here. Thank you so much. Water floss is a great addition. So this is the water pick product is a great addition, but alone does not clear plaque well, like water over rocks in a river. I wish they would make the claim that it replaces string floss. Okay, that actually, I haven't used the Waterpik water flosser, but using the power flosser, that again, I couldn't get over because of that wide stream technology in the X formation, that it did clean a very, very broad area. I work with disabled patients who cannot care for themselves. What should we suggest for oral hygiene maintenance? Well, there's a number of things. First of all, we really want to be able to talk with the caregiver. That's critical to have an opportunity to be able to educate the caregiver and provide the caregiver with the tools, because exactly like BJ Fogg was saying, with no fault of their own, they're feeling helpless. They're feeling a lack of success. And if we're able to give them the product, and for instance, maybe, it could be looking at the portfolio of power toothbrushes. They don't have to go with the top of the line Prestige or Diamond Clean Smart. Maybe they go with a protective cleaner, an expert clean. So there's ways to do that as well. What is the best way to talk about oral systemic health with pediatric patients? Pediatric patients, I think it's good to help them understand that, talk of the body as a highway. And that I don't like saying the word bugs, but sometimes that is a motivator. But the bacteria, those foreign things that get inside their mouth, the things that are yucky that you want to make sure you brush away. If you don't have access to the rest of your body, and you're going to be around for a long, long time. And even though you're not worried about your health today, what you do today will influence tomorrow. Is it possible for blood tests to include CRP every 6 months? I love this question that was asked. And again, I'm just watching my time to make sure that we don't go over. I think we're just at 1 minute after 8, so I'll finish up shortly. But yes, sometimes there is a small incremental fee that has to be paid. I can't speak to every state and every province. I'm Canadian. But an HS high sensitivity CRP test is something you can ask your medical provider for and is a critical barometer. I would highly suggest, if you haven't had this done, to make sure that you do. Any contraindications to the quad flosser? Not that I'm aware of. A Philips representative told me yesterday not to use essential oils in the Sonicare water flosser. I would agree with that. And thank you. Thank you for the good topic and well explained. Can't wait to share. That's wonderful. What are your thoughts on the product All Day for dry mouth? It does contain xylitol. I will answer this as a last question. This is from Angelica. A good question. All Day does have some great products. They have a patented muco adhesive, but again, they are water-based. So it is repetitive use, but something like this would be a good adjunct to use as well with a Quarrel. The difference with the Quarrel that I was speaking about is that lipid-based product. It's a palpable difference when you use it. It does contain xylitol, but again, it's in a very, very small therapeutic dose. So it is not going to be in a dose high enough that it is going to impact caries management specifically, but just having protection and having more of a saliva in the mouth and more feeling of saliva that a Quarrel will bring, for instance, is going to protect that compromised environment. So I'm going to end it there in respect of your time, but thank you so much for your time this evening, spending it with me. And I hope that you recommend the webinar to other members of your team. Thank you.